So in this session, we'll deal with the anatomy of the internal ear or the inner ear. So internal ear, it has a bony labyrinth which is filled with perilymph, and there is a membranous labyrinth within the bony labyrinth which is filled with the endolymph. It is located in the petrous part of the temporal bone. The functions are, here the mechanical energy is converted into electrical impulse, conveys the sense of hearing and equilibrium by means of vestibulocochlear nerve. You can see here, this is the bony labyrinth. So the parts of the bony labyrinth from anterior to posterior are the cochlea, the vestibule. You can see here there is fenestra cochleae within the scala tympani, and here you can see the fenestra vestibuli within the vestibule, and here you can see this is the anterior semicircular canal and the posterior semicircular canal. The 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 medial end of the anterior semicircular canal and the superior end of the posterior semicircular canal both join to form the crus commune, and here you can see the lateral semicircular canal. So you can see the dilated ends of the semicircular canals, ampulla. So here you can see this is the external ear, this is the auricle, this is the external auditory canal. Here you can see the tympanic membrane. So these are the ear ossicles, and this is the internal ear, the cochlea, the vestibule, and the semicircular canals. You can see here the vestibulocochlear nerve. So if you see the structure of the cochlea, so there is a central modulus which is cone shaped. The apex of the modulus, we call it as cupula, and the base is having multiple perforations, so called as tractus spiralis foraminosus, and it is having a cochlea which is surrounding the modulus. So the turn is 2 3/4 turn or 2.75 turn. So you can see here the base of the cochlea is towards the internal acoustic meatus. You can see here there is a osseous spiral lamina projecting from the modulus into the cochlear canal. You can see it is having a vestibular lip and a tympanic lip. From the tympanic lip extends the basilar membrane, and slightly behind the tip of the vestibular lip there will be attachment of the vestibular membrane. So this attachment divides this cochlear canal here into the scala vestibuli above the vestibular membrane and scala tympani below the basilar membrane. So here you can see between the vestibular membrane and the basilar membrane is the cochlear duct, which is a part of the membranous labyrinth. So this is the modulus and this is the cochlear canal. So the turn of the cochlear canal is 2 3/4. So cochlear canal is coiled around the central core, the modulus, the apex of which is called as the cupula, and the base is having multiple foramina called as tractus spiralis foraminosus for the cochlear nerve. Now we can see here, if you trace this, here you can see a small opening through which the scala tympani and scala vestibuli are communicating near the cupula, that is called as helicotrema. And if you observe, the scala vestibuli is continuing with the vestibule, whereas the scala tympani is closed. So close to the basal turn, the scala tympani presents an opening, the fenestra cochleae, which is closed by the secondary tympanic membrane, and you can also see the aqueduct of cochlea through which the perilymph communicates with the cerebrospinal fluid in the subarachnoid space. Now if you observe, so this is the bony labyrinth. In that we have finished with the cochlea. Now we are seeing the vestibule. So the medial wall of the vestibule is having the crust of the vestibule, which divides the interior of the vestibule into an antero-inferior spherical recess which lodges the saccule, and a posterior-superior elliptical recess which lodges the utricle. The scala vestibuli, here you can see the scala vestibuli is continuing with the spherical recess which lodges the saccule. Here this is the elliptical recess which lodges the utricle, which is connected to the 3 semicircular ducts which are present within the semicircular canals. So these are the semicircular canals. This is the interior of the vestibule, so within the bony labyrinth. So there is a crust called vestibular crust which divides the interior of the vestibule into antero-inferior recess, spherical recess which receives the scala vestibuli, and there is a elliptical recess posterior-superiorly which receives the opening of the semicircular canals. And you can also see on the medial wall there is an opening for the aqueduct of vestibule which lodges the saccus and ductus endolymphaticus. So here you can see the membranous labyrinth. So in the bony labyrinth the parts were like this: the cochlea, the vestibule, and the semicircular canals. Now in the membranous labyrinth, you can see here. So within the cochlea, there is a cochlear duct, the apex of which is called as legina. The apex of which is called as legina. The cochlear duct continues with the saccule through ductus reunions. The saccule and utricle are connected by a utriculosaccular duct, which is continuous with the ductus and saccus endolymphaticus. So this comes out through the aqueduct of vestibule, and ductus reunions is the connection between the cochlear duct and the saccule. So here you can see there is macula within the saccule and utricle, which is concerned with the static equilibrium and linear acceleration. So here you can see the ampullary crest or crista ampullaris within the ampulla of the semicircular ducts. This is concerned with the kinetic equilibrium and angular acceleration. So within the cochlear duct, there is organ of Corti which is concerned with the hearing. So here maculae and utricle, so maculae and the maculae in the saccule and utricle and the crista ampullaris within the ampulla of the semicircular duct. So all these are concerned with the balance, whereas the organ of Corti within the cochlear duct is concerned with the hearing. You can see here, this is the organ of Corti. This is the organ of Corti. You can see this is the basilar membrane on which there is resting of the organ of Corti. If you observe from osseous spiral lamina, you can observe here these are the inner hair cells, a single row of inner hair cells. You can see 3 rows of outer hair cells. You can see here these are the outer rods of Corti and these are the inner rods of Corti, so which are enclosing tunnel of Corti, which are enclosing tunnel of Corti. Now here you can see these are the diter cells. These are the diter cells which are supporting the outer hair cells. And here you can see the Hensen cells which are outside the outermost row of the outer hair cells. Here you can see the cells of Claudius. Here you can see the cells of Claudius. So these hair cells are having processes called stereocilia. So here you can see this is the membrana tectoria. This is the membrana tectoria. So you can see this is the spiral ganglion of the cochlear nerve. So these are the peripheral processes and these are the central processes which form the cochlear nerve. So the peripheral processes are reaching the inner hair cells and the outer hair cells. Inner hair cells and the outer hair cells. We'll classify the hair cells into type 1 and type 2 in the further slides. So whenever there is vibration of the ear ossicles, there will be vibrations in the perilimb, so that the basilar membrane will vibrate, and these stereocilia will be pressed against the membrana tectoria, and there will be conversion of mechanical energy into electrical impulse, which is carried by this peripheral process and through the central process. Here if you observe this cochlear duct, you can see here laterally there is stria vascularis, which is a 2 to 3 layered structure where there will be rich capillaries and 3 layers of epithelial cells. And here you can see this is the vestibular membrane. This is the vestibular membrane. Here you can see the basilar membrane. So vestibular membrane, basilar membrane and stria vascularis forms the boundaries of the cochlear duct, which is present within the cochlear canal. So scala vestibuli is outside the vestibular membrane and scala tympani is below the basilar membrane. So scala vestibuli and scala tympani, they are having perilymph, whereas the cochlear duct is having the endolymph. But this tunnel of Corti and the spaces around the hair cells and between the diter cells and Hensen cells, here there is cortilymph, which is more similar to perilymph than the endolymph. So here you can see the type 1 and type 2 hair cells. In type 1 hair cells, the afferent fiber is directly in contact with the type 1 hair cells, whereas the efferent fiber is synapsing with the afferent fiber. So efferent fiber is modulating the impulse traveling through the afferent fiber. But here directly in type 2 hair cells, you can see both afferent and efferent fibers are in direct contact with the hair cell. So that means both the fibers are directly modulating the stimulation of the hair cells. So when the afferent and efferent fibers, both fibers are in direct contact with the hair cell, we call it as type 2 sensory cell. And if only afferent fiber is in contact with the hair cell and the efferent fiber is trying to modulate the impulse traveling through the afferent fiber, we call it as type 1 hair cells. So inner hair cells are type 1 hair cells, whereas outer hair cells are type 2 hair cells. So here you can see the macula within the saccule and utricle. So this macula, they respond to the static equilibrium and linear acceleration. So you can see here in the organ of Corti, we have seen membrana tectoria. Here there is a membrane called otolithic membrane. So where there are calcium crystals called otoliths. So they respond to the gravity. Here you can see there is a kinocilium. Here there is a long kinocilium and the stereocilia. So when the stereocilia bend towards the kinocilium, there will be excitation. When they bend away from the kinocilium, there will be inhibition. So if you see the macula, it is having the supporting cells and it is having the hair cells. And there is a gelatinous matrix here, that is the otolithic membrane. So macula is present in the facula and utricle. They are mainly concerned with the static equilibrium and linear acceleration. You can see here. So this is the head upright position. This is the head bent position. You can see the otolithic membrane is being acted by the gravitational force. Next, you can see the crista ampullaris. You can see a cone-shaped gelatinous structure called the cupula. So earlier also you have seen a cupula, that is the apex of the cochlea or the modulus. So here you can see here the cupula, it is a gelatinous membrane which is present in the crista ampullaris. So here you can see the supporting cells and the hair cells. Again there is the kinocilium and the stereocilia. So this responds with the kinetic equilibrium and angular acceleration. So this crista ampullaris is present in the ampulla of the semicircular ducts. There are three semicircular ducts, the anterior or superior, posterior and lateral semicircular ducts. So these are responsible for the kinetic equilibrium and angular acceleration. So you can see here the head being rotated and you can see the cupula is being bent and stimulating the kinocilium and the stereocilia generating the impulse. You can see the direction of the semicircular canals. So this is the superior semicircular canal of left side. It is parallel to the posterior semicircular canal of the right side. Same vice versa. Here you can see that this is the superior semicircular canal of the right side, which is parallel to the posterior semicircular canal of the left side. So the superior and anterior semicircular canal creates an arcade eminence on the anterior surface of the petrous temporal. Here you can see the lateral semicircular canal which lies horizontally. So here you can see the horizontal semicircular duct. So stimulation of the lateral semicircular canal. So like if you see, so this is the rotation, this is the direction of rotation and ampulla is moving towards the kinocilium. The stereocilia are bent towards the kinocilium. That's why there is stimulation of the right horizontal duct and there is inhibition of the left horizontal duct. So movement or the bending of the stereocilia towards the kinocilium causes stimulation, whereas movement of stereo or bending of the stereocilia away from the kinocilium causes inhibition. So this is the crista ampullaris within the ampulla of the semicircular duct. Ampulla is the one dilated end of the semicircular duct. The other end is normal. So applied aspect tinnitus. It is due to peripheral cochlear dysfunction, that is continuous ringing sensation in the ear. Vertigo. This is due to excessive stimulation of the semicircular ducts. That is the either the we feel that we are rotating or the surrounding is being rotated. Then motion sickness. This is due to excessive stimulation of the utricle and sacral. It is characterized by nausea, vomiting and giddiness. Meniere's disease, it is vertigo, tinnitus and progressive impairment of hearing due to distension of the cochlear duct. So you can see the caloric test. So if you observe, if you put cold water into the ear, you can see here there will be nystagmus towards the opposite direction. If you put warm water, there will be nystagmus in the same direction, that is a rapid phase in the same direction. So cause cold water opposite direction, warm water in the same direction. So stimulation of the semicircular canals by using differential temperature, that is a caloric test. So this nystagmus should be there. If there is no nystagmus, there will be complete labyrinthine dysfunction. Thank you.